So I pick my daughter up at school and we're driving in the car. That's the time when the kids tell you everything. And my daughter is telling me how she learned about climate change and how important it is and all the things that have to be done and how the government's not doing the right thing and all of these things. And I said, yeah, I remember when I was in high school, we learned about greenhouse gases, and then I remember people coming up to me and telling me I had to get involved in this issue. And that was when I was in college. And she said, she looked at me, very quietly said, "You mean you knew?" I said, I didn't know what to say. I felt not proud of myself. I felt like I felt unproud. I felt like I let my daughter down. I felt like she was just so in shock, and everything shifted. It wasn't a light, lively conversation. It was like, wait a minute, you knew, and you didn't do anything? Yeah. So when I think about the issue of wireless radiation, I think about the same thing. I know, and something has to be done. It doesn't mean that I don't want to work on so many of the other very important issues on this planet, on the earth, and I'm quite actually involved in several of them. But this issue, what's the point if we're going to be sick? And this is about our kids' future. They're going to be exposed for an entire lifetime to an environmental pollutant that many scientists say causes cancer, that damages the brain, and it's like the companies. Something that Lloyd Morgan, who is an engineer who's published a lot of papers, and he always says that the wireless industry makes big tobacco look like a mom and pop shop. The wireless industry makes big tobacco look like a mom and pop shop. I sometimes think of it like there's this chessboard and we're in checkmate. They have covered all the bases. They have all the regulatory bodies. They have massive PR and a whole media campaign. They've got all of these op-eds and articles online that people read, and of course we want to believe that cell phones and wireless and cell towers and 5G is safe because we love it. We love it so much that when we read that, we don't take the time to dig. And frankly, if you take the time to dig, you're going to be digging a long time, because it takes a long time to dig up the dirt. But let me tell you, once you start digging, it's like a whole festival. It's like, whoa, whoa, there is so much there. And you realize that this industry manipulation of the entire landscape has been going on for years. And not only that, but decades ago, they got in with the World Health Organization EMF project, totally separate than the World Health Organization International Agency for Research on Cancer, which determined, the IARC, International Agency for the Research on Cancer, determined that cell phone radiation and wireless radiation, radio frequency radiation, is a Class 2B carcinogen. And that was a decade ago. And there's so much more research that has come out connecting the exposure to cancer, so much so that many scientists say at this point there is more evidence, and wireless radiation causes cancer. Or some say wireless radiation probably causes cancer. And if you know about how things go in the regulatory world, once you become a probable carcinogen, there are regulation changes that are bound to happen in several countries. And not only that, but, when things are defined as a carcinogen, a human carcinogen, you have to have a heck of a lot of numbers. And those numbers are dead people. Those numbers are dead and sick people, so that the researchers have had time to study, and they've collected the numbers, and it's overwhelming evidence. Like I remember just a few years ago when air pollution became defined as a carcinogen, and I was like, wait a minute, didn't we know that? Didn't people know? I mean, when I had my kids, lead was not such a big deal, according to the pediatrician who told me I didn't need to test my kids for lead because of the zip code that I lived in, unaware that, of course, my house was from 1929, I think it was, that house, which had chipping paint everywhere. Now, and at that time, the limit at which anything happened was 10. Now they say there is no safe limit, right? So things change over time, and the only way that we get full protections is when there are enough sick people. Look at smoking. Look at smoking. I mean, that was known for a long time, and our government didn't act. I remember when there was smoking in schools, and then they had a special place for smoking. And then kids and teachers used to go to a special place where they smoked and everyone knew. And now, of course, you're not allowed to smoke in public places and not in schools. But, I mean, I remember when there was smoking everywhere. You'd get on the airplane and you'd be, like, filled with smoke from the smoking section, which the smoke went everywhere, of course. So, but I don't know. What is it going to take to learn the lessons of history? I know that we will get there, and I also know that the only way to get there is for everyone to push. It can't be just one person. All hands on deck. This is an all hands on deck situation. And if you're listening, most likely you are working, and I am so honored to be working on this issue with you, because I know what it takes, and I know how hard it is. And I have talked to too many people, and I hear the same story, and it's so heartbreaking. People who are injured and who are sick and who can't find a place to live. People who have cancer, many of whom have passed away, who have so courageously spoken out, when they are going through so much, because they know that the truth has to be told, and the truth is that this radiation is not safe, and it's harmful. It harms our bodies, it harms bees, trees, birds. And there is no proof of safety. In fact, if we started to do the research that was needed, I think it would be quite clear. But what industry is doing quite effectively is defunding any governments from doing research that would actually determine if there were a problem or not. I mean, some of the studies that are being done, funded by certain other countries, of which I won't mention, are just absurd. It's designed to show no effect. And here in the United States, where we did the $30 million study of animals in order to understand if it could cause cancer, and we found clear evidence of cancer, and we found DNA damage, nothing's happened because the wireless industry so effectively war-gamed the science. And I use that term because that's the term that the PR firm and the Motorola, they had a conversation where they called it wargaming. And I remember those films, oh gosh, what was it called? War games, where you'd fire up in the air and you'd hit the asteroids coming down or whatever's coming at you. You'd aim. So whenever there's a study that shows a problem, aim and fire. And how do you do that? How do you wargame it? You downplay the findings, you attack the scientists who did it, you attack their method, you publish criticisms, you say, well, they found this, but they didn't do this, that, or the other. Or you do another study. Hey, let's design a replication study to test that one. That's actually happening right now. So the NTP study is being replicated with industry funding in some other countries. Now, if it doesn't show an effect, well, the NTP study was useless. Even though the Ramazzini Institute, which is also independent, found the same tumor types elevated, and they used much lower levels of exposure. I mean, how does that happen? You have one study in the United States, very carefully designed in terms of what the animals were exposed to. That's why we do animal studies, because we can control the exposure. Whereas with people, if you ask me how long I use a cell phone, well, I might also have a router by my bed, or I might live near a cell tower, or I might eat the best food, or I might not have a genetic history. There's all these things that kind of complicate things when it comes to human studies. You really need to watch people for a long time and get a lot of data to find things in human studies. It takes years and years. But with animals, you can expose them, you can know what they eat, you can use all the same kind of animal and really see, was it the cell phones? Was it not the cell? You can really suss that out. That's why experimental studies are so important. So the Ramazzini Institute does a study with much lower levels of wireless radiation, and they find the same tumors, the same kinds of tumors that are found in people who use cell phones for long term. So we have the same tumor types in animals, highly controlled study. We have it in lower levels, and then we have it in people, same tissue type of tumor. I mean, that is called they're all in agreement. All these studies are showing the same thing. This is when you listen up. And then you've got studies that are done at the cellular level in petri dishes, and they're finding effects. And it just goes on and on. The question is, what is it going to take? What will it take to wake people up? And I get it. I didn't want to know this. I really didn't. I was absolutely heartbroken. I felt like I was breaking up with my country. And I haven't. I love my country more than anything. But at the time, I felt like I was breaking up with someone. How could you? It was like, wait a minute. You telling me you didn't test for long-term exposure, and I got my kids on the phone with my grandparents, and you didn't tell me? And it was like, wait a minute. You didn't test? I was heartbroken. I was sad. I was mad. I cried. I did, because I did not want to know. I was like, no, this can't be happening. This is like some strange movie. I'm stuck in a horror film. It's like a horror comedy, because the more you learn, the more you just have to laugh. I mean, how could it be that the chief scientist of Motorola is heading up the group that our country is putting forward as one of the groups that help make these limits? And how did that happen? And how come our web pages actually, while the web pages of the FDA and the CDC might look like safety is assured, but I've been following those sites, and we screen save them, and we follow what's going on, and you cannot believe the monkey business that's going on with our federal agency websites. And the real fact is, not a single one of those agencies, for whatever they have on their website, none of them have looked at all the research and tried to find out, looking at the research and the effects that have been found, do our safety limits, do they protect us? And none. Not the FDA. Go to the FDA site. Just take your time. Go to that little review they do, and you go into the review. You see it's a review. It was actually not looking at the standards and the levels of the standards and doing a systematic review, and where you could see all the effects at all the different levels. So that was not done, actually. And not only that, but it was only about cancer. It wasn't on brain damage or reproductive damage. So, no, not the FDA. And even if it were the FDA, let's pretend the FDA actually really looked at this issue and looked at everything about this issue. Well, the FDA certainly has no jurisdiction over birds, which sit on the cell antennas, or trees, whose limbs are right there, touching or quite near the cell antennas of 5G small cells and all these cell towers. And not only that, but there actually is no agency, not even the FDA, whose job it is to have authority over cell towers. So, that's not what they do. They're not in charge of making sure that the limits for cell tower radiation are protective. In fact, there's no one who's actually acting with any funded mandate to ensure that. And in fact, it's not just, they're not even testing to see what the levels are. So we got these situations in our community where there are cell towers literally built on top of apartment buildings, and these apartment buildings are in like L shapes, right? So you'll have an antenna here, and I'm not talking about high up, I'm talking about like antennas on the rooftop. And then you got that L shape, so then the antennas are right in line of sight of these people's bedrooms. It's really unacceptable what's going on, and nobody's checking radiation levels. Other countries, even though they're not doing the best job, at least they're putting that information up. At least they're publicly posting it. I mean, the way that industry has gotten away with this is defunding the science, especially in the United States. And then the science that is being done is mostly funded by industry. Just ask your federal officials, how much money is being used to test if 5G or if wireless is safe. And you will find that the answer is zero, as far as I know. So now, the National Toxicology Program is doing some studies. It's unknown what they are. I don't have that information. That would be nice. It's on the website. There's a little bit of information, but it's not what you would expect, being that every person is being exposed to this kind of invisible radiation. You would expect that we would really, really be investigating this. I mean, we're talking about babies. Babies are being handed cell phones as toys. In my case, I had a sling and a baby carrier, and I'd put my babies in that, and I'd take that phone, put it right on the back, put the baby with the phone. When I nursed my baby, I had that phone in the sling. It was just kind of a good place for it. No one told me. Why didn't anyone tell me? So when I learned about it and researched it to death, because I didn't really want to know, but I knew how bad lead brain damage was, and I figured I better find out about this one because, I didn't want to have a problem with my kids. So I looked into it, and I had out my yellow Sharpie marker, and I had all this research, and I'd take my little yellow marker, and I'd be like, oh, where's the effects? Oh, I learned what an electromagnetic field was. Whew. I didn't know what that was. I mean, I'm a social worker. I know about theories of psychology and sociology. I know history. I studied history. I certainly didn't know what an electromagnetic field was, other than, an electrical thing. And there I went into the rabbit hole, and what's a modulation? I mean, what in the world is a modulation? But anyway, there we are, and it took time. But once I read the letters by U.S. government officials and scientists where they were saying there is a problem with our limits that have to be looked at, and those limits were those letters were never responded to. Once I did that hurt me. I was like, whoa, wait. So I have government scientists who are saying there's a problem with the limits, and nothing's happening. And then when I learned that the 1996 Telecom Act basically made it so that you can't really argue about an environmental effect so long as it's FCC compliant with these limits, these FCC limits, and that are sky high. They're not protected, but you can't. Every time you go to a council meeting or you try to change where a tower is based on health, they say, well, no, the 1996 Telecom Act does not let you do that. And it's like, well, first of all, that's an overstretch. That's a overinterpretation of the statute. But be that as it may, that is what your elected officials will tell you. But it's like, why is that? I mean, if it's so safe, if it's so safe, why can't you talk about health? Who does that? Who says you can't talk about health? What kind of crazy law is that? So the Telecom Act, the 1996 Telecom Act, was actually the most heavily lobbied bill at the time, and it possibly still may be. I mean, look at what these companies have been able to do since then. They have basically taken over in a way. They have gotten deregulation. They have created the digital divide. And now with 5G, we want to give them more. We want to give them more. We want to let them have more leeway and more permission to do whatever they want. And they claim they're going to fix the digital divide. And they claim they're going to bring us energy-saving devices and that they're going to solve all the world's problems. That's what they say. And our elected officials are swallowing that hook, line, and sinker. You would think that, how did this happen? And I think part of it is industry lobbying, and there is a lot of industry lobbying, and there's a lot of monkey business. Again, I gotta tell you, some of these school superintendents have really gone down for what they did with those deals, the wheeling and dealing that happened related to the iPads and the wireless devices and all kinds of crazy stuff. But I also think that one of the issues is that we don't want to believe it. So really good, people that are good people and have good motivations, not that the other people are bad, but that really want to do the right thing, just can't believe it, because it really, really? You're telling me that the government didn't check before they put it on the market? Really? How is that possible, How is that possible? It hurt my heart. I have to say, I found it very, very disturbing. And I've shifted my whole life. I've changed everything I do. I had a lot of friends. Well, maybe they weren't such good friends because they're not my friends anymore. They're afraid of me. They're afraid because I might talk about cell phones, or sometimes they'll talk to me, but they will be like, well, your issue. They don't want to talk about that issue, 5G or wireless or whatever. And that's sad. That's really, really sad. But I'm honored to be working with people that have a clear sense of purpose and clarity that we have to fix this. This is too important to be worried about what other people think, or we have to fix this. We gotta fix it. And we are, and we will. So, thank you.